We now have a first national picture at how this pandemic could unfold in this country. Canada's top doctor released predictions for the best and worst case scenarios on how many people could become infected in Canada, how many people could die from COVID-19. And we've also got a much better sense of how long these strict public health measures to stop the spread are likely to be in place. We'll also look at some other data today, employment numbers that the Prime Minister calls stark. More than 1 million Canadians losing their jobs just last month from the pandemic shutdowns. Let me go to my colleagues, Catherine Cullen and Vashi Kapelas. I'll start with you, Catherine, because I left off with Vashi. And Vashi was making a good point about sort of the pressure being put on the economy to loosen the public health measures, which is what has obviously suspended the state of the economy. But also, I think, given that the Prime Minister is now talking about a fairly long timeline, the new normal of living like this, you know, Canadians' resilience to sticking to those measures as well. It is, I know there's jokes about people, you know, it's not that hard to stay on your couch, but it is asking a lot of people to restrict their interactions with others.
That's right, yeah, and you rightly referenced that phrase, the new normal, which I think is going to be, for many people, the big takeaway from today when we look at the time span of this. I want to grab onto that idea Vashi was talking about, though, about the economic implications. Now, on the one hand, you heard the questions to the Prime Minister, how long can the Canadian government sustain this sort of financial support? What are you prepared to do? I think one colleague phrased it, you know, essentially, how much rope do you have? And he said, listen, we'll be there as long as we need to be there. Now, I think it's important, though, to consider a couple different aspects of this. Yes, there's the question of direct economic support that the government is trying to provide to Canadians who have lost their job because of COVID-19. But there are other effects as well in terms of businesses of all size. But of course, we think particularly of small and medium-sized businesses. It's one thing if this is just a few weeks. Some businesses may be able to sustain themselves, but the longer this goes on, the bigger the economic impact on that front, and the questions about what sorts of jobs will be available for people to come back to. You really got a sense, particularly in his opening remarks, that the Prime Minister was trying to be encouraging. You know, he said at one point in his opening remarks, when the economy comes roaring back. But it really was a very sobering message today, I think. You know, he talked about wavelets as well, the possibility of these smaller waves afterwards. And we want to juxtapose that with the message from public health officials earlier. Theresa Tam saying, listen, if we loosen measures too quickly, it could ignite a whole other problem. So this difficult balancing act that the government is trying to do on an economic front, on top of the sort of more personal morale questions. I think some of this is being asked, of course, because people know that they're going to get tired, if they aren't already, of staying in their homes. But, you know, the stakes are so incredibly high.
That's right. I was just going to say, I mean, the reason this is being said today, the reason the modeling was being put forward, the things the Prime Minister said, it is actually about saving lives and how many people's lives can be saved depending on the rate of infection. And we got some of those numbers today. If the rate of infection is 2.5%, which it is not now, there are still 11,000 Canadians who will die, and it'll put, as Dr. Tam said, an enormous amount of pressure on the healthcare system. I do think, as you say, Catherine, that the Prime Minister was trying to be encouraging for all of us to stick with this. And I will just say, because I've had a couple questions on Twitter just about the upcoming weekend, which is a celebration of Passover yesterday, Easter. I know Ramadan is to come. When public health officials say stay within your immediate family, they mean the people that you live with. They don't mean your aunts and uncles who live in other places, or your parents or your grandparents. They mean the home that you live in. Those are the people you can celebrate with. Nobody else, unless you FaceTime or Zoom or however you want to celebrate those things. But I think that's really important to remind people as we move forward. That is their best advice for us.
The example Dr. New gave, I think, is probably especially pertinent, right? Talking about his own children, who you might think of as your immediate family. He said he has children in Montreal, and he's only going to be speaking to them virtually.